What's up, everybody? Welcome and welcome back to another one of my YouTube videos. If you're new here, hey girl, hey boy, what's happening? What's going on? My name is Apparently Blunt. Thank you so much for taking the time and tuning in to another one of my YouTube videos. If you don't know what my channel is about, let me tell you. My channel is about lifestyle, it's about vlogs. I give you guys a lot of tips about different things that I've gone through, just basically just tips that you all need, okay? So if this is your first time looking at this video, welcome. Go ahead and don't forget to subscribe to my YouTube channel because you're gonna like this video and you're also gonna like all my other ones. So do yourself a favor and subscribe to my channel. If you also are new here, then you probably don't know that I recently just had a baby almost a month ago in a few days. And basically I had an emergency C-section. The video right before this one is my birth story. So if you're nosy or if you're just a little bit curious or if you're trying to get pregnant or are currently pregnant now and you just want to see what it was like and what I had going on, listen, go ahead and check out that video. Since I did have an emergency C-section, I have a ton of people who are asking me for different tips and what I did based off of the hygiene of the C-section, the incision, how is it healing, what's going on, what did I do? So this video is for you. It's just a quick video to just give you guys a little bit of tips and tricks on what I did. So the first thing, a C-section is short for a cesarean. So a C-section is basically another way to have birth, and that is when they cut open 5 to 6 layers of your stomach to get your baby out, okay? So that is just the 411/definition on what that is. When you have a C-section, it is totally different from when you are giving birth naturally. And you know, some people think that the C-section is the easy way out, and it actually is not. Your recovery process and your healing process is way longer than having a natural birth or a vaginal birth. So don't think that you're off the hook and that, you know, your C-section is so good because you don't have to experience the contractions sometimes. No, sis, you still up the creek, okay? So let's go ahead and start talking about some hygiene tips that I did, what helped me, what can help you, what can help somebody else. Don't forget to share this video to anybody else that you know who is going through this or have already planned their C-section, or just in case if you are currently pregnant, you may have a C-section. So this video is gonna be very helpful to help you clean the incision area. First things first, wash it, okay? Obviously we have to shower every day. Listen, you're not really supposed to be taking any baths, so please do not take any baths. I don't think you're supposed to take any baths until about maybe a month or so. I personally say that you probably take a bath maybe in 6 weeks. I don't know. I don't take baths. I don't like sitting in dirty water. That's not my type of tea. I like to take showers. I like to rinse it off of me. I'm not getting down with that. So if that's you, you know, I don't know, maybe ask somebody else who take baths and when you think you should take it, because I don't get down that way. Sorry. When you do take a shower, it is very important that if you don't have a six-pack, like most of us do not, then you need to lift up your stomach. Be very careful when you lift up your stomach. You should be numb anyways from your belly button down. Pretty much I'm still numb down there for the most part, and it's been almost a month. It's very weird. I know it's weird. If you never had a C-section before and you're looking at this, you're like, what? Why are you so numb? Yes, I am still pretty much 85% numb from my belly button down to the top of my vaginal area. So no, I cannot feel it. That's why you have to be very careful when you're lifting up your stomach so that the water can basically clean it down there. So what I do is I don't use super hot water because you don't want to risk that. You don't want to risk your stitches busting wide open, and just still hot water is just not good on open wounds. I do like a cool and warm temperature water when I'm in the shower, and I just lift up my stomach and basically I get like a little puddle of water. You know, when you get a little puddle of water and you just kind of swish it up under there. It really depends on how much you weigh and like how big your stomach is when it comes to cleaning your incision, because it can be easier for somebody else with a smaller stomach and then probably a little bit more harder for somebody who has a little bit extra weight on them. So it's like, if you do have a little bit of extra weight on you, I really highly suggest that you really lift up your stomach so that you can kind of feel the water, or do the cup trick where you get a little bit of water in your hand, or actually you can get a cup and while you're in the shower, just get the cup and just kind of swish it lightly, gently, but just swish it up under there. I would say do this, probably count to like 120 seconds, 180 seconds, and then you should be good. When you are cleaning down there, I know sometimes some doctors or hospitals may say use mild soap. I mean, what is mild soap? I don't know what that is. So don't use soap at all. Of course, you use soap to wash yourself, but I don't recommend that you use any type of soap on an open incision down there. It doesn't really matter. I personally, right now, I have dissolvable stitches. Basically, dissolvable stitches mean that in a few months or a few weeks, whatever, that my stitches are going to automatically dissolve. Some people don't have this, so you know, I am solely talking about people who have stitches that they don't have to get removed. So these are my steps for someone who is going through something like that. Of course, get out the shower very slowly. Now the area is wet. The doctors will tell you the importance of keeping the area dry. So some people will recommend that you put cornstarch or anything down there. Don't do that, y'all. We don't know what's in this cornstarch. We don't know what's in all those powders. Don't do that. What I do, and no one told me this, I actually was reading an article, but what I actually did to keep my area dry when I got out the shower was I used a blow dryer. Now, before you look at me like that, no, not a regular blow dryer. When I use a blow dryer, I use it on the cool setting, okay? So basically I lifted up my stomach and I use a blow dryer for about 3 to 5 minutes, and I just blow dry it, but only on the cool. You do not want to use hot or warm. Before I put my underwear on or whatever, this is what you need to do. Speaking of underwear, it's really good that you use cotton. Cotton is very breathable. So when you are choosing your undergarments, you should really use cotton. And some people actually put pads under their incision, or they use cotton gauze. I don't use gauze because gauze actually makes me feel really uncomfortable, and it's kind of like when I put the gauze under my stomach in the incision, I kind of feel the cotton gauze and it is really uncomfortable, and I feel like it's rubbing against my stitches, so I don't use that. But you do leak throughout the day, so if you want to use something there, or if you want to use some gauze, that's fine. Speaking of leakage, let's talk about that. So you are leaking throughout the day. I know that sounds crazy, but I am still on month 1 or about to be on month 1. And yes, I am leaking. So let's talk about the different colors when it comes to leaking. Okay, so when you look at your incision, and another thing that I suggest, if you want to see what's going on there, use your phone, use a flash on your phone and video record it. Don't even take pictures, just use your phone and use it on the video setting so you can really see what's going on there. When you take your phone, really lift up your stomach and see what's going on, what kind of fluid is down there, what kind of leakage you're having. So you may see little drops of blood. That is totally normal. If you are actually dripping blood, that means that one of your stitches are probably out and you need to immediately go to the hospital so they can stitch you back up. If you have any dark green or any green fluid, that means that you are probably having an infection. If you have any yellowish or dark yellowish fluids, that probably means that you're having an infection and you need to hurry up and see your OBGYN or go straight to the hospital, just depending on how you feel. If you have any white fluid, then that is good. That is okay. If it's clear fluids, that is fine. Throughout the day, if you don't really use like a cotton pad or use a pad or any gauze or anything like that, just make sure that you shower probably twice a day, because you're probably gonna feel, or you're probably gonna be itching, probably in the top of your vaginal area, because you are leaking and you have nothing there to stop it. And I know this is a lot, but it is what it is, you guys. So just make sure that you're showering more often if you're not putting anything under there, just like me. I don't wanna put anything under there, so I just have to shower and make sure that my hygiene is up to par. Also, if you are having and experiencing any smell there, that means that you also probably have an infection. The common smell that you may receive from your incision is like a fishy light smell. If you have that, you probably have an infection. If you do have an infection, what they're gonna do to you at the hospital, or what your OBGYN is gonna do, they're gonna take this really long cotton stick and they're gonna take like this alcohol substance, and it does hurt really, really bad. They're gonna clean it out, lift up your stomach, really clean it out. You're probably gonna be very sore for a few days when they do that, and they're gonna use this alcohol-like substance and it's gonna burn. So like I said, you're probably gonna be jacked up 3 to 5 days after they do that, if that is your case, but it is what it is. Pop a pill if you're hurting that much and move on about your day. Also too, if you do get infected, then what your OBGYN or your doctor at the hospital, they are gonna prescribe you some antibiotics. You have to usually take these antibiotics for about 10 to 14 days. Probably it's gonna be a large pill, 1 in the morning, 1 at night. So you may not be or may not have an infection, but your doctor probably just wanna make sure you don't. So even if you don't have an infection, better safe than sorry to take the pill and let it clear everything up. And if not, sometimes it may be really bad off that, you know, the pill is just not even working. So that's when you really have to go to the hospital so they can fix and tell you what is going on. So from the beginning to the end, these are all the tips that I have. Getting a C-section is a very slow recovery. You know, we are not gonna be able after 6 weeks to go weightlifting or really go running again or go walking. It's probably gonna take us some months. And you know, congratulations to you if you had your baby. You are still a great mom. That does not mean you cheated the birthing process because you had a C-section. It is tough work, it is hard work, and it hurts. It hurts a lot. Okay, so congratulations to you if you did have your baby. I love you guys so much. If you're thinking about getting pregnant, do it. It's the best decision ever. Yeah, the birthing process probably sucks. Yeah, the labor process is gonna suck, but it is honestly the best thing and the best thing that I've ever done for myself. So I love you guys. Thank you so much for tuning into this video, and I'm gonna talk to you guys later.